Okay, so now the prescription indicates that I need to irrigate with 30 mLs of sodium chloride. So I'm going to pull up 30. Okay. Try to gingerly get rid of some of the air. And again, when I irrigate this, I'm going to use the port. I'm going to shut it off to the exit. And I'm going to irrigate to see if there's any occlusion, but everything seems to be irrigating well. And again, the drainage is kind of bilious brown.
Is that normal?
Yeah. I've got it back open to the suction.
Yep. Okay, what do you want to do next?
I think what I'm going to do next is I'm going to demonstrate turn, cough, deep breathe and incentive.
Why was that prescription ordered?
Postoperatively, moving the patient around helps stimulate circulation. I'm not going to turn the patient because of this scenario, but I'm just going to explain why. Coughing and deep breathing moves things around in the respiratory system to prevent pneumonia, atelectasis, and this patient has a COPD history, so it's important.
Good.
And then the incentive spirometer is, I'll do that next before I demonstrate the coughing and deep breathing. Maximizes inspiration, so the patient takes a nice deep breath, getting rid of the anesthetics and also preventing complications. So the patient would do this every hour times 10 while awake. And the patient would put this in their mouth. They have again, the inspiratory, maximum inspiratory volume goes up with time. They usually start at 1,000. Take a nice deep breath and hold it for 10 seconds. And the patient's going to do this 10 times an hour while awake.
Okay.
Okay. Now for coughing and deep breathing, again, we're going to instruct the patient to do diaphragmatic breathing. So at the end of the diaphragm, put our thumbs together, taking a deep breath. And this should be done every 2 hours. Now, if the patient's to cough with abdominal or thoracic surgery, we need to make sure to splint the stomach. So we usually tell the patient to take a nice breath and then cough it out.
Nice, good job.
Yep.
What do you want to do next?
The next thing I'm going to do is I'm going to do the wet to dry sterile dressing and for debridement purposes of this open wound, and then I'm going to do the Jackson pack. Out in the bag. I'll wash my hands in a moment. Okay. I'm going to date it ahead of time for ease. Okay. Got my bag for my forceps. Okay. I'm going to wash my hands before the sterile procedure. Now what I'm going to do is take off the old dressing. Put her head down because her sap was okay. And I seem to be noticing serosandwich
Correct.
drainage.
Yep.
I'm going to keep it away from me. I'm going to open up my stir field. Okay, I'm going to put my gloves on, put my rail down, my bed up just a tidge more. Oops, my thumb just touched my arm, Marcia.
Okay.
I
so-
need to get a new,
Okay, so you know what you need to do.
Yes.
All right, that's your first mistake.
okay. I noticed that the wound is well granulated
That's
and
good.
no signs of infection. I'm going to clean. I'm going to clean the wound top to bottom.
Yep.
Away from me, top to bottom. And towards. I'm going to pack the wound. I'm going to open this so it's nice and loose and fluffy, so it doesn't put a lot of impingement of circulation on the wound.
Okay. Nice.
I'm going to put the outer, now it's clean. Okay, I'm going to tape and take care of my patient. Date, time, and initial.
Nice. Yep. Good job.
And I'm going to take care of this first, and then my trash.